You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. With us, we have an expert on the topic. According to her, your smile, an improvement to your smile, can change your life. With us, we have Florida's cosmetic dentist, Dr. Morris. Dr. Morris, welcome to the program.
Thank you. Great to be here.
So before we get into today's topic, tell me a little bit about your practice, the procedures you do, typical patient. I know that your husband works there with you. We've had him on the show.
Right, great. He and I work together, and he does all the surgery in the practice. He does implants and grafting.
He's the dental implant king,
He is that. He loves it. And I do all the cosmetics, the reconstruction, restorations, and the cosmetic side of the practice.
Okay, good. And on my shows, and I told your husband, I said, I don't endorse the people that come on my show because it's a real show. You know, I mean, this isn't scripted. But the photos, and for people watching, you got to stick around for these photos because you took regular people and they look like movie stars.
Absolutely.
I mean, that's without exaggeration. I always like to say that we have experts on our show, but in this particular case, you are an expert on the topic. I mean, you were a clinical instructor.
Yes.
For cosmetic dentistry. I mean, dentists from all over the world, literally,
Absolutely.
would come to listen to you lecture.
Yes, and I taught for at least 10 years at a very unique dental institute where dentists from all over the world would fly in with their patients, and we would reconstruct and do cosmetic dentistry on their patients. So that is a very unique situation.
How many years did you do that, by the way?
10 years.
10 years. And you've been practicing, I know your age, and you look probably, 20 years younger than your age, but you've been practicing 27 years.
27 years, yes. Yeah, so I've done a lot of dentistry. I have a lot of experience.
All right. Now, when did you know you want to be a dentist, by the way? Because you don't look like a dentist. Do people tell you that?
I've heard that a few times,
okay.
Yes. I had a terrible childhood experience with my teeth. I did not breathe through my nose until I was 11, and so my teeth did not come in when they had to be surgically exposed to come in. And by the time I was starting high school, I had 4 teeth.
Interesting.
So it was a very insecure time. I would try to practice how to smile so people wouldn't notice in front of the mirror. And I remember I never thought anybody would tell me I had beautiful teeth. And I remember the first time I actually had beautiful teeth and I smiled, it was like suddenly I could just let my personality come out. So I have that passion in seeing that happen for my patients, and I totally understand where they're coming from when they don't like their smile.
Now, you're a dentist, and I said, respectfully that, of course you think the smile is important. How important is the smile?
Absolutely.
In your view?
Well, I think it's very important. I see ladies in my town that have facelifts, and they do everything they can. I saw a lady the other day at the grocery store, and she smiled, and she had yellow teeth, and it is, to me, one of the first things you notice is the smile. Things that age us are our teeth, our hands, and our neck. You don't realize how your teeth are slowly aging, and it happens very slowly. And then there's a tipping point where they don't look so good anymore.
Okay, good. Now what are the different categories? If you had to categorize cosmetic dentistry, what are the categories?
You can have whitening. Just simple whitening can really make a big difference in your smile. A chipped tooth, you need a little bonding, a little reshaping. If your teeth are starting to wear, that'll give you that aged look. And so you can go from veneers to actually when the face is starting to sag and the nose and chin are getting closer together, you can actually use that to support the face and give your face a lift. We call it the dental facelift.
Now, do you think the perception, and I know you want to go positive, okay, but do you think the perception is everybody's doing it the same way as far as cosmetic dentistry?
I think so. I think sometimes they think it's like shopping for a car, when really it's not. You can't just dabble in cosmetic dentistry and do a great job. It is a separate field. You don't learn these things in dental school, so you have to go back to school.
You taught this for 10 years.
Yes.
At the most prestigious cosmetic dentistry, facility in the world, okay?
Yes.
What's the hardest thing to teach about creating this natural smile? Because I feel like I could spot veneers. I told you, I could spot veneers walking down the street.
Right. How to make it natural.
Okay.
How to make the smile fit the face. The creativity and the artistic eye that a dentist needs to create in order to really
But can you
create.
teach that? I mean, as an instructor, teaching dentists this, I mean, don't they I mean, can you develop an eye? I mean,
You
some people
can.
just don't have it, you think?
I think some people are better. It's just
Okay.
like any artist. You know, Da Vinci, he was pretty amazing, and there were other artists too. So it's creating the eye, and there's probably some natural ability in there too.
But when looking for a cosmetic dentist, look at their photos?
Look at their photos, look at their training, see if they've gone through any rigorous programs. Like the American Academy of Cosmetic Dentistry, I'm accredited, so that means I've gone through rigorous presentations of my cosmetic cases
What
and
percentage
peer
of dentists
reviewed.
have gone through that?
There's only 300 of us, probably less than 300 worldwide that have become
So that's less than
accredited.
about 2% of dentists? 3%?
Yeah, I guess.
Okay.
Yes. Yeah. So
Good
those
for you.
things you have to, experience does matter. You need to see before and after pictures of the patients that they've done, not just purchased pictures.
And they travel to see
schooling.
you, is that right?
Yes.
I
Yeah,
can't
we
imagine people
have.
getting on a plane to go to a
Oh
dentist.
yes, we have a lot from Europe that come to Sarasota and have their dentistry done. We have a lot of patients in our area that live here maybe 2 or 3 months of the year, and they live somewhere up north. And for some reason, when they're in Florida, they want to have their teeth done.
Because you're a
And,
destination spot.
We're a destination spot, and also because we do so many things under one roof, and we have all of the high-tech equipment right there under one roof, they want to have it done there.
Okay, good. Now you
Yeah.
brought some photos because you say you could change your smile, you could change your life, and it makes big differences. And for people just tuning in, I mean, some of these photos are so dramatic.
Yes,
They don't even look like the same people.
that's right.
So let's take a look.
They
What
don't.
do we-
So let me show you Brian. Brian's kids
Wow.
actually contacted us because Brian was staying in his home. He wasn't coming out. He had all these spaces and gaps in his teeth. He'd had some traumatic events happen, and he didn't have a job, and he was depressed. The kids actually contacted
Interesting,
us.
interesting.
Yes. So they care about their dad. They want their parents to be happy. So with Brian, we filled these gaps. We did porcelain restorations. We did a couple bridges in the front without metal, and it was pretty amazing how it changed his life and the perception. He got a job. He got out of the house. It was
But just
quite
because
an
his
emotional.
teeth, he got a job?
Oh,
done?
absolutely.
I mean, you believe that?
Well, it was his confidence. You know, when you
Okay,
feel
okay.
better about yourself, just like to be able to smile and be confident and to speak and not have to hide your teeth or your mouth, it can make a big difference.
Let's take a look at the after.
I want you to look at the difference in the smile. Look at him before and after, and look at his eyes, his confidence. He
All right.
doesn't even look like the same guy anymore. So if he's on a job interview and he's out there, you can just see the confidence in his face.
What do they say when it's all over, by the way?
They just can't believe it.
Is it emotional when he sees it
It's
in the mirror for the
emotional.
first time?
I once had a patient tell me it was like getting out of a wheelchair. It was
Interesting.
that big. He had hated his teeth his whole life. He was a very successful attorney, and he said, "Jill, when you gave me my smile, it was like getting out of a wheelchair." So that was such an impact on all of us in the office that heard that.
Now, and I talked to your husband about this, who's also a dentist in your practice, but he says there's a lot of people that go around, they just don't smile
That's right.
because they hate their teeth so much. Do you hear that? I mean, do they?
Oh yes, absolutely. We had one patient who stopped working outside of the home. She hid super glue around the house. Her family didn't know she was doing this because her teeth were falling out, and she would super glue her teeth.
Wow.
And it was a tough decision for her to call the office, but she did. And after we did her teeth and restored her smile, she got a job outside of the home. Her family told her to stop talking because she had stopped talking before, and now all she did was talk. It changed her life.
So you have more photos.
Oh, absolutely. Now, these are our typical patients.
Okay.
The Kroons, they'd come down, they were visiting from New York, and one broke a tooth. And they came in, they liked the idea that we could take care of them and create a better smile. And
So when you look at that, what needs to be done in your mind?
Well, Martha had bridges and they were breaking down. They were done different times, different stages. So when that happens, the bite changes, the teeth can wear down. Her teeth were getting darker because of the wear, and she was having problems. Things were breaking. So
Well, what about him? He looks pretty good.
yeah, he looked pretty good, but he wanted to have things redone too. This couple, they're health fanatics. They want to have the best, healthiest life they can, and they want to look good. And so they talked to their kids and said, we think we're going to have our dentistry done down here. And so we redid their smiles and we gave them better function and
Let's
health.
take a look.
So here they are. It's,
Oh my goodness.
It really, she can't wait to smile. She said all she does is smile. She walks down the road and is just beaming. So now their smiles reflect the health and the vigor and the happiness that they truly feel. So it's exciting. Here's another one, Randy. This is Rob. So Rob came in and he was scared to death. He hadn't been to the dentist in a long time and he had gum problems. He was going from this person to try to figure out what to do. His gums were bleeding. He couldn't eat. He didn't like the way his smile looked. He knew he was at the point in his life when he had to do something.
Okay, okay.
So with Rob, there was a lot going on. He had 4 teeth that had to go, and Dr. Backey did implants, and we treated his gums with the laser and gave him a little sedative. And we were able to save his teeth with implants and with restorative veneers and give him better chewing ability and save his teeth.
Let's take a look at that after.
So here he is afterwards. He looks terrific.
Okay.
And
is he an actor? I mean, he looks like something.
He does. He does look like
royalty
an actor.
or something.
He's just a very, very vital, outgoing man. And so soon afterwards, his wife followed, and she had very yellowing teeth, and she saw him smiling every day with these white teeth, and she thought, I want to look good too. So she had old bonding on her teeth, and look at what we did for her. So
Wow.
we did veneers for her, and we whitened, fixed the wearing edges, and now she looks like they're a couple, and they have beautiful teeth, and they have glowing smiles, and it was, you know, combination dentistry with veneers and
They
implants
look like a
and
different couple
things.
now.
Yeah. So let's take a closer look at her after. If you look at her smile, it follows her lip. It's broad, which means that it's nice and broad.
So when you say it follows the lip, the teeth kind of follow
the lip.
Interesting.
The teeth are not the same length. As we age and we wear down our teeth, all the teeth become the same length. So she's got the middle teeth are a little bit longer, nice broad smile, nice and clean and white, and that is a good example of a smile design.
So there's like
youthful look.
porcelain veneers.
Porcelain veneers, exactly.
And they'll last as long as like regular teeth if she takes care of them.
Absolutely.
And they don't stain, is that right?
They don't stain. You can drink red wine, you can drink espresso, coffee, and they don't stain.
What do they say when it's all done? Like somebody like this. Do you remember?
Oh yeah, absolutely. They say, why did we wait this long?
Really?
Or they'll say things like, it's the best thing I ever did for myself. Absolutely.
Really?
Yes.
They say that.
Yeah, they love it. They love it. This is Carol, and if you look at Carol's teeth, they're very crooked. She never liked her smile. She hid her smile. Very afraid also to have dentistry done. And so...
When you say they're afraid, are they afraid of the pain? Afraid of what they're going to look like?
They have bad memories from childhood.
Okay.
So they're afraid of what may happen in the chair. All of the above. They're the fear of the unknown. They don't know how they're going to look when they're done. You know, possible pain and things like that.
Do you think
so all of those things.
women like going to a female dentist? I mean, when they see you, they don't expect.
I think they do. They expect the female dentist to be a little more nurturing, maybe to listen.
Or gentle,
yeah,
probably, too.
a little more gentle. Absolutely.
So do you get the highly anxious people? They go to you, and the tougher ones go to your husband in the practice?
Possibly, yes.
Okay.
Yeah.
So with her, now when you see a smile, like a woman that comes in like this, okay, when you are on the consult, what does she say to you? Like, what are her goals?
she'll say she wants to have teeth like everybody else she sees on our wall. A lot of people say that. They look through our books and they just want a nice smile, something that they don't have to be worried about, embarrassed about, hide. That's what they say. And the important thing for me is to listen to what they have to say and really key into what they want. So with her, it was just amazing because we did what we call instant orthodontics. It's not orthodontics, it's just putting the porcelain veneers on the teeth and making them look straight.
The after is very nice. The before and after is nice.
Yeah, it's nice. And in fact, when they smile, you can see the difference in their eyes. Look at the difference between the before and the after. You'll see their eyes are happier, they're more open, their smile, of course, is broader. And it does take a while for them to learn to smile again because they're so used to hiding their smile. So they're just a more relaxed, happy individual when they have their teeth done. It's wonderful. Bob and Ann, another couple from the Midwest, they moved down from Indiana.
A lot of couples doing this together.
They do. And they had retired and they were here in Sarasota and they wanted white teeth, straight teeth. They had waited, worked hard all their lives, and now was the time for them to do it. So this is Bob. He looks like $1 million when you see him.
Yeah.
And Ann followed suit, so they got porcelain veneers, which gave them whiter teeth, teeth that were more symmetrical, and they were like movie stars walking around town.
I think anybody that sees this would agree with that.
Yeah. Yeah, and just great people from Indiana.
So these are just regular people.
Yes.
But they end up looking like this.
Yes.
And so with his teeth, I mean, what goes into something like this? I mean, how do you judge it, and how much say so? I mean, I guess what I'm trying to say is, how does the patient know what the outcome is going to look like?
Well, many times what we'll do is a temporary that is the color that they think they want. We go through an interview to try to listen to what they want, figure out the length of the tooth, and we'll put temporaries in their mouth. And with the temporary, they get to test drive and see how it looks, make sure the length is correct and the design is correct. And we get it exactly like they like it, and then we send that to our laboratory and we say, this is what we want.
So what's the turnaround time? Somebody watching this, okay? They don't like their smile. They go in, everything's, in a perfect world, how soon can you
3
take
weeks.
somebody like this guy? Really?
3 weeks, absolutely.
And just a few visits, couple visits?
Couple visits for our international patients or people that are traveling. We schedule everything. We call the laboratory ahead, and sometimes we can even do it in a couple weeks. So, but we have it so planned out, and we're used to these things in the office that we can create a smile very quickly. That's beautiful. This is Nancy, typical of people that don't like to smile. She was having some TMJ issues too. So she was having some popping and some clicking and didn't like her smile and came in and...
Do you have to force some of these people to smile? Because they don't like their smile? Oh,
absolutely.
Because she almost looked like she didn't want to smile.
That's right. She didn't. And they actually subconsciously create a way of smiling because they may put their head down or look away or not smile. So people may think, they're unfriendly or just, not happy.
Okay.
And with her, basically, we did veneers, but we also helped her with her TMJ, the popping and the clicking, and got a little bit of a facial change with her. And it's pretty amazing.
That's very nice.
Yes. Yes, it's excellent. And so one of the comments that she made, of course, is she loves her teeth for the first time ever. And also, she doesn't have the clicking or the popping, and she just feels like she can eat better. So it's wonderful. She was also very afraid. And so we used some
fear of the dentist?
Fear, she gagged. So we used some techniques in the practice to help her get through that, so it disappeared. And now,
how many years, by the way, when we go back to that before photo, how many years do people, do they tell you, I haven't liked my smile my whole life?
Some people do, but some people will say, I really liked my smile in my 20s. People would say, oh, you have a great smile. And little by little, things started to change. It's very subtle, these changes, and now they're like, I want my smile back, and they'll bring in pictures of their smile. And you don't realize that time goes by, you're living your life, you're putting your attention into your family or your work, and you know, now it's time to change your smile and actually have teeth that look like you feel.
Okay, okay.
Yeah, to reinvigorate
That's a very
your life.
nice photo. I mean, she just looks happier, more professional.
Absolutely.
It's a very pretty smile.
And she's a wonderful lady, and now this matches her personality.
Okay.
She's great. Kelly. Kelly's another example of somebody that professionally wants to give a better impression on the job. He had his own company, but he thought his teeth were too dark. Kelly's teeth really wouldn't respond to whitening. He had tried whitening in the past, but if you look closely, you can see the edges are worn. And he had some tetracycline staining, which is very hard to whiten. So he wanted to close that gap and just give himself a vital smile that is white, like he'd always wanted. So he had the making of a beautiful smile. He had nice broad teeth, broad smile, good-looking guy.
Do you get excited about this? I mean, on the consult, do you say, "Oh boy, this is going to be"?
Oh,
good?
I can see it. I can see it. I can see the future, and it's
Do you tell
very
them that
exciting.
sometimes?
Yes, they look at me like, you know, they don't believe me. They can't believe it, but I can see it, and it gives them hope.
Okay.
You know, they get
okay.
very excited about it. So here's our movie star guy now.
Oh my goodness.
Beautiful smile. Nice and broad and even and white, and it's just terrific. So let me ask you, Randy, do you think you could see that these were veneers?
No, no.
No, absolutely
And I told you
not.
I could spot them.
That's right,
okay.
that's right. Very, very natural. But more than that, he looks healthier, he looks smarter.
That's true, that's true.
The perception that he's, you know,
sophisticated.
Sophisticated, like
he looks
model.
like a multimillionaire or something, like heads a company.
Yeah, that's right.
I mean, he looked like kind of a kid in the earlier.
Yeah.
Now he looks like a successful
absolutely.
man.
Absolutely. And
Interesting.
it's the confidence in the smile.
I'm trying not to side with you on this show, by the way, but I can't help but say that these are very, very good, dramatic photos. Good for you. And what does a guy like this say when it's all done? Like when he looks at himself in the mirror.
He said it was the best investment he'd ever made. And he owned his own company. And he said it was absolutely the best investment that he'd ever made in himself. So
good,
I agree,
good.
Much better than a car or something like that. Yeah,
okay, good,
absolutely.
Good.
You take it everywhere you go. So.
All right.
This is Sandra. Now, Sandra's a beautiful girl. She's Brazilian, and she came to me because of headaches and migraines. And it was really her bite that was causing her problems. Of course, she wanted beautiful teeth also, so that was a nice side effect for that. But what you'll see with her is a beautiful smile, but also no more headaches. And we can do that. We use neuromuscular equipment in the office where we can help people with TMJ and headaches. And
we haven't mentioned that because today we're talking about cosmetic, but I mean, you are known for helping people with bite issues.
Absolutely,
when their teeth don't come together correctly, is that right?
That's correct. That's correct.
Okay, good. So we have time for probably one, maybe two more photos.
All right. Well, this is Ziva. Ziva helped her husband for the last 2 years. He was actually very ill, and so she kind of just put herself aside for that. And she had many problems. She had bleeding gums. She was missing some teeth. She didn't like the way they looked, of course, and so here's the new Ziva. And she just looks fabulous and healthy, and she really did
it. Like a European actress of some sort.
I know. She's fabulous, but she did it mainly for health because of the connection between the health and the teeth and the gums.
So if their gums are bad, though? I mean, bad gums, can they get veneers?
They can. They can get veneers. We want to make the gums healthy first, though.
Can you do that?
We can absolutely do that. We have lasers now that painlessly, easily can treat gum disease and bring the gums back to health, because that's very important. We look at the whole body.
Let me take a look at that photo one more time. And you can see, there's no doubt about it, people will perceive, and we talked about this on the phone, and I always think you guys are exaggerating, but when I see these photos, it actually, you're right, they're going to be perceived differently. No doubt about it.
Absolutely.
Just because of their smile.
It will change their life.
Okay, good for you. Good for you.
Absolutely.
One more.
One
That's all we have
more.
time
Okay,
for.
well, this is what we call our non-surgical facelift.
Okay.
This is Linda. She actually came to me for TMJ again. And if you notice, her nose and chin appear too close together, and that happens as the teeth wear down. So when the teeth wear down,
The lips what?
the lips curl in,
Okay.
you get the jowls, the nose and chin get too close together, kind of like lifting the floor and having a curtain buckle.
Okay.
And so by building up the teeth again to where she was in her 20s, it looks like she's had a facelift.
Interesting. So that's just the teeth are kind of...
Yes, like if I will ask people this, I will say, what did I do for her? And they'll say, oh, you did her cheeks or you did her lips. All I did was her teeth.
Her teeth.
Yeah.
Okay, good. We're out of time now. Final message. Somebody watching this, okay, they don't like their smile. What's their first move? What is your advice to them?
Give us a call.
Okay.
Yeah, absolutely.
Is it a free consultation? Could they go and meet with you?
They can meet with me. We can take some photographs. They can show me what they like, what they don't like, what they'd like to change, and just kind of get to know, you know, how they feel and get to know each other.
And options. So, you know, we've talked a lot about, you know, veneers and things like that, but small things at the very top of the show can make a big difference. Whitening, just small things.
Oh, the whitening procedures have changed so much. They've gotten so much better. So whitening, shaping of the teeth, you know, bonding a chip. There's a lot of things that we can do today now that are simple
and you call
make them look
yourselves
better.
the power of two. You and your husband, they're just tuning in, your husband, Dr. Burbacki, Dr. Jill Morris right here, you call yourself the power of two. Why?
Well, for
That's
patients,
like a slogan of yours.
It is. It's very convenient because many times if I'm doing something and let's say the patient needs an implant and I'm doing veneers, he can just walk right in the room and do the procedure while the patient's sleeping or watching movies. So it is so convenient for a patient to be able to have their dentistry done under one roof. It is one, and the communication you can imagine between us.
Good, good. Okay, so if they want to know more about you, go to your website. All the photos are there.
That's right.
All right. I want to thank you so much for coming to the
Yes.
show. Great
Thanks,
stuff.
Randy.
Great info. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, just go on our website at wellnesshour.com, put in Dr. Morris. For now, I wish you good health.